Avian flu has infected a record number of birds and some mammals across the United States, and scientists are keeping close watch. World Health Organization Director General Tedros Adhanom Ghebreyesus said Thursday that the risk to humans remains low, but added, "We cannot assume that will remain the case." As with the coronavirus that causes COVID-19 that is believed to have started in animals before spreading to humans, some animal viruses can mutate, jump species to make humans sick and spread quickly around the world. But highly pathogenic avian influenza is no COVID-19. Scientists are reassuring the public that, with a few rare exceptions, the virus hasn't made the jump to humans at a large enough scale to trigger an outbreak. It has gone far beyond birds, though, and its recent spread among members of a separate species has some experts concerned about the way the virus is changing. Avian flu is a type A influenza virus that originated in birds. The version that's predominantly causing problems in the Americas and Europe is called H5N1. There are several subtypes, and H5N1 bird flu viruses commonly in circulation now are genetically different from earlier versions of the virus, according to the U.S. Centers for Disease Control and Prevention. Since late 2022, scientists have detected this virus in more than 100 species of wild birds like ducks, seagulls, geese, hawks and owls in the U.S. Globally, this strain of the virus has actually been around a lot longer, said Richard Webby, an infectious disease researcher at St. Jude Children's Research Hospital in Memphis, Tennessee, and director of WHO's Collaborating Center for Studies on the Ecology of Influenza in Animals and Birds. By the 2000s, it had spread into parts of Europe and Africa and then got carried into the rest of the world through infected migratory birds. It came to the Americas more recently, Webby said. The first infection with this version of the virus was reported in wild birds in the U.S. in January 2022, according to the CDC. The next month, the U.S. Department of Agriculture announced an outbreak among turkeys in a commercial facility. Studies have shown that bird flu may spread to songbirds, but the ones that typically gather at feeders, such as cardinals, sparrows or blue jays, and those you may see on the street like pigeons or crows do not typically carry bird flu viruses that would be a threat to humans, according to the CD. Ducks and geese can carry the virus without appearing sick. Poultry isn't always so lucky. Highly pathogenic avian influenza carries very high mortality rates among chickens and turkeys. The disease can affect multiple internal organs, causing death in 90% to 100% of chickens within 48 hours of infection, according to the CDC.